Let's go to Victorian Federal Liberal MP Katie Allen now. Thanks for joining us, Katie. Has this gone too far in your home state? You're locked in curfew after 8 p.m. at night. People can't go to work. People are allowed out of their homes for only an hour a day. Now you've got police flying drones in the sky to make sure they're abiding by these rules?
Thank you, Chris. Unfortunately, we've had to go to this stage in order to contain the epidemic. And if we had done at the state level what we had to do, which was quarantine effectively, and then have a proper strategy with regards to tracking and tracing, we wouldn't be in this disaster that we're in now. I have to say that we now have a pretty severe situation. We are containing the epidemic, which is a good thing here, because if Victoria can't contain it, then we're going to have problems at the Australian level.
But this presupposes it's an either-or situation. You either do nothing or you have this kind of lockdown. We're talking about drones in the sky to make sure Victorians aren't at the local skate park. This is over the top, isn't it?
Well, I argued very early on that we needed to make sure that we had a targeted approach. And in fact, that's been the National Cabinet approach, which is make sure your quarantine services are absolutely, essentially well done. And we've had reports now of how we've been let down by the Victorian government here with regards to quarantining. Premier Andrew has put up the white flag and handed over those services to other states. So we now have people from Victoria who are quarantining in other states because he knows he hasn't been able to deliver on that service, which is the role of the state to do. And then the second thing is he's had overwhelmed services with contact tracing and have not been able to contain the pandemic. And if you look across the border to New South Wales, Gladys Berejiklian is doing a very fine job with a very importantly focused team that's containing the pandemic in New South Wales.
We have borders closed all around the country. We are being told that they're not going to be open this year in most cases. You've got this enormous amount of social and economic disruption, yet you're still seeing 3/4 of all the deaths are actually occurring in aged care settings. Shouldn't we be looking at doing a lot more to protect the aged, the elderly, and allowing much greater freedom around the rest of the country?
Yeah, I think that the strategy we had set at the start of this pandemic was the right one, and that is about suppression and containment. It was never about eradication. We were very clear about that from the top, from the federal government, engaged with the National Cabinet. So some states have decided to go it alone with certain things, and they have that right, and they need to be held to account when they've decided to do things differently. But the federal government has had a very clear strategy that, when executed properly, was working and continues to work in all the other states. It's just that Victoria has let the side down.
Well, you're a public health expert. Apart from being an MP, what do you think can be lifted first up in Melbourne? Do you think the curfew can be the first measure to go, or you can reduce the stage 4 lockdown? What would you be looking to do as soon as possible to protect the health and well-being and social freedoms of Victorians?
Well, I think there's two aspects. Of course, there's our social restrictions, but then there's our impact on our businesses. So we are very much about the economic recovery and what we can do to get businesses back off their knees and on their feet again. And that's got to be the absolute central focus of what we do. It's all about job recovery. It's all about making sure that we get the economy kick-started again. So any of the restrictions that can be lifted that can help that economic recovery is going to be the things that I would recommend going forward. Of course, this is a dual crisis, a health and an economic crisis. And from the health point of view, we want to maintain any good outcomes that we've had, but looking to see if we can open up the economy is going to be a very important aspect. Now, the curfew has been very difficult for Victorians, I have to say. And, you know, if people are not doing what they should be doing, then I don't really understand why a curfew after 8 is really going to help that. What we need to have is very clear public health messaging about what is the right thing to do and what is not the right thing to do, and that it's proportionate and targeted. So it was only a matter of weeks ago that home quarantining on the DHH website said, if you're in home quarantining, you may even have COVID, you are allowed to go outside for a walk, which you're having COVID cases out walking around the community, and yet we know that if you've got COVID, you should stay home. So this mixed messaging was very different from when I looked at the other state recommendations on their websites, which is if you're in home quarantining, stay home unless it's a medical emergency. Don't give them permission about all these sorts of going out and exercising without saying wearing a mask, and by the way, don't pick up the milk while you're there. So this mixed messaging, if you've got COVID, you should stay home. That messaging wasn't clear on the government's website. It wasn't made clear by the Premier in his press conferences. He had the ears and eyes of Victoria on him. Why didn't he remind people who have COVID, stay home? And as a result, the whole of the state's restrictions have had to be imposed because he hasn't done this clear messaging.
This exactly amplifies my point. This is why a big government approach has failed. Daniel Andrews actually imposed the curfew and stage 4 restrictions while they were still advising people who were positive, who were infected with coronavirus, that they could leave home for exercise. We've got to surely see a switch in this country to personal responsibility, greater freedom. I mean, the experts, Professor Peter Collignon and others tell us all the time, it's all about that hand hygiene, masks, social distancing. If we adhere to those rules, of course, we greatly minimise the chance of infection and cross-infection.
Well, it's a really ideological approach. I mean, our approach as federal government is about targeted response, both from the health point of view and the economic point of view. It was working. When you do a one-size-fits-all, which is everybody has to give up their freedoms, when people who are meant to be staying home aren't staying home because they haven't got the right message. So there is a difference of opinion about how to approach this. And I really back in Scott Morrison, the Prime Minister's approach from the very start. We're going to have to live with this virus. We know that Australia is an island continent. We have Australians returning home. We need to make sure that they're quarantined when they're coming from hotspots or anywhere else in the world. We know that we can't completely have impervious barriers. So while we have a virus which has this pesky pre-symptomatic phase, which for 14 days you may be shedding the virus and yet you don't know you have the virus, then we need to have very clear quarantining mechanisms, guidelines, public health messaging that if you're at risk of COVID and you need to stay home or in quarantine, do it effectively. And that's where the major public health message must be. And then the second thing is the health authorities who are tracking and tracing need to do that job effectively, as Gladys is doing in New South Wales. And then thirdly, people need to keep themselves safe by using physical distancing, masks when necessary, and of course, good hand hygiene.
Indeed. Katie, have you had your hour outdoors yet today?
I try to sit. I'm actually in home isolation with my family before going to Canberra.
Oh dear, you don't even get an hour outside.
No, we don't go outside our house, that's for sure. We've been very, very careful the whole family.